My name's Rebecca Feldman. I'm an assistant professor of physics at the University of British Columbia in the Okanagan. My focus is on medical physics. And yes, there wasn't one thing that got me interested in science. It seemed to be all around me when I was growing up. My dad would come home from work and there was a particular pair of shoes that wasn't allowed to touch. I was told there was radiation on them, and I didn't really know what radiation was, but they looked identical to the pair of shoes that he wore at the grocery store. So I didn't really understand how that could be dangerous, but it turns out that he was working with a special type of tracer that could cling to his shoes, and he didn't want me, as someone growing, to accidentally carry it with me and affect the way I was growing. And then that got me interested in looking up radiation and half-life and decay and continuing to ask those questions. At the same time, my mom was a potter, and yeah, she made these beautiful bowls that had these brilliant bright colors on them. But when she was mixing her glazes, the colors were dull, and she mixed these dull rust-colored powders that said iron oxide or other chemicals, and they would go from this mud brown to these brilliant pieces of art that we then used in the kitchen every day. And the way that application of heat can cause these simple chemicals to change color was fascinating. And there were all of these instances all around, including like Saturday night TV with my parents. We'd watch Star Trek, and the character I most liked, the one who was problem solving with technology, was Geordi LaForge, the engineer, and I would spend hours running around with a headband over my head, pretending to be the engineer on a starship. So my research exists at the intersection between physics and medicine. I work with really powerful magnets that form a magnetic resonance imaging system, and this system lets us non-invasively investigate the body. So that means we're able to see what's going on, the shapes and the structures inside your brain or other parts of your body, without cutting into you or injecting anything. And this can be really useful if we suspect that something's wrong, but we're not entirely sure. MRI images take pictures primarily of the water in your body, and you're made of mostly water. And the signal that we get, it's either strong or it's weak, and it depends on the environment that the water is in. So for example, in your brain, if the water is in your blood vessels, it can appear dark, whereas the surrounding tissue can be much brighter. So we're able to see what's going on with the blood vessels in your brain, the arteries or the veins. My research focuses on developing new techniques to expand the amount of information that we can get from these images. As I mentioned before, blood can appear dark or light depending on how you manipulate the magnetic fields. And my job is to try to figure out the best ways of adjusting these magnetic fields, either through hardware or software, or even exploring the signal after we've collected it, so that we can tease out more information from these non-invasive medical tests. One of the most exciting projects I had a chance to work on was using 7 Tesla MRI systems. Those are the most powerful clinical imaging systems in the world, on patients who had epilepsy, but no one could figure out why. And so they'd had all sorts of tests done, and their brains appeared normal on 1.5 Tesla, on EEG sometimes. And we were able to scan them using new sequences on 7 Tesla MRI and discover abnormalities. Things that weren't present in normal brains were present in these brains of people who were suffering from seizures. And we were able to identify where the seizures originated and help the physicians decide what the best course of treatment would be. I think the biggest challenge is every time I move, I have to start new. So I moved when I started university. I moved when I started graduate school. I moved for my first postdoc, and now I'm here in the Okanagan, and I am happy to be here. But it's not easy. And when I start new in a new place where I don't necessarily know many people, I have to both draw on the experiences that I've had before, what I know has worked for me in the past, but also be flexible. So when somebody comes and offers to show me the best wineries, I've never lived anywhere that has had wineries before, and you say yes, and I say yes. Or someone offers to take you down the rail trail, and you didn't even know that was a thing. That could never have fit into the plan that I started my day with, the plan that I started my week or my month with, because I didn't know. So my plan gives me a direction, but the flexibility to say yes is what makes this my home now. I think the most important thing is that you know that you don't have to be the best to make focusing on something worthwhile. The first time you try it, you're probably going to be pretty bad. And yes, you may get encouragement. People might tell you that you're doing pretty well. But you may not be the best, and it may still be worthwhile to work on. The more you do something, the better you get at it. And just little improvements over the course of a week, a month, a year, if you keep at anything, whether it's math, even though you don't think you can do math, or language, even though you're not getting your verb tenses right away. If you keep at it and you look back a year later, you're going to be amazed at how far you've come. And even if you're not the best in your class, even if you're not the best in your school, when you leave with that skill, you're going to be able to apply it.